That's why it's important that someone else is responsible for that, because I always dive in and get started and forget to get the recording going. So we want to make sure that we record for any individuals that aren't able to join us today. We will be posting these on our website that we'll share a bit more about later. So with that, we'd like to do some introductions of our extension team. For those that are able to be present here today, we are, again, grateful for you. And we recognize that from the beginning of last year when we did these introductions to this time this year, we've had a lot of change and transition among health department staff. And we've also added new health departments that are a part of the MCH adolescent well-being effort. So we wanted to make sure that we took some time to introduce ourselves to each of you. My name is Danette Hopke, and I'm the Behavioral Health Program Manager. I'm also the project manager for this technical assistance grant. And I am excited again to be a part of this process with all of you. I'm going to hand it off to Jen Braun.
Thanks, Jeanette. I'm Jen Braun. I am the Health Equity State Specialist for the Health and Wellbeing Institute. I'm happy to be here. I'm going to hand it over to Debbie.
Good afternoon, everyone. I'm Debbie Moellendorf, and I am a health and well-being educator. And I've been in various roles and have been helping to support this grant and excited to continue in that role.
Thanks, Debbie. Christina, we've talked a lot about you, but why don't you introduce yourself?
Oh, I'm sorry. I did not realize I was on this list. Hi, everybody. I'm Christina Davenport. I'm the administrative assistant for the Health and Wellbeing Institute in the Division of Extension. And I will pass it to Danette. Did you already go?
I did, but that's all right. I believe Amber is, if Amber's on, I'm not seeing her. She can go ahead and unmute, but I think she's unable to join us today. And Taylor is our community youth development educator. She's also unable to be on the call today, but you'll be able to see Taylor in future sessions. For those of you that have joined previously in 2023, Taylor was a part of several learning community calls as well as our office hour sessions. So her name may be familiar to you. So she has joined our team as a permanent part of our core team supporting this work and these efforts today, or this year, I should say. With that, let's do a quick review of our agenda for the day so you all know what is in store. We are going to spend some time today hearing from Maggie and with some DHS updates. We've already introduced ourselves, helped you get to know us as your extension support, technical assistance support. We'll be talking a bit about our adolescent well-being scope of work. We'll also be introducing you to Extension as a whole and who we are and what we do across the state of Wisconsin. Then we'll have a great opportunity hear from Debbie and her Raise Your Voice team on the eastern side of the state and the work that they have done, as well as 2 counties that are embarking on Raise Your Voice efforts as well. So we're excited to be able to share a variety of perspectives with you on the Raise Your Voice project and what that might mean if you support your adolescent well-being efforts across the state. We'll also get an update from our youth wellness team. We'll talk a bit about our future learning community calls, office hour sessions. We've got some resources to share with you. And of course, we'll close out our call today with an opportunity for you to share feedback with us. So please stay on until the end of the call so that we can get your feedback on how this call went and also your suggestions for future learning community calls. With that, I'm going to toss it to Maggie, who I saw on the call, for an opportunity to share.
Yes, I'm here. Thank you, Danette. For those of you that I haven't met, I'm Maggie Smith, she, her, and I'm with the DHS Adolescent Health Team. So I have been in this role for a couple of years now. And the updates on my side of things right now are pretty light, and most of them should be things that you've heard already. So you should be receiving an email, if you haven't already, from your 2024 contract administrator at DHS. So that's kind of your go-to person, regardless of which objectives you've selected. So it will be the person leading the work for one of your objectives. So if you have more than adolescent well-being, it could potentially be someone else on the DHS team as well. And And then from that contact person, you'll get reminders that are pretty, hopefully pretty familiar. They're things that have gone out already. One being that we have a contact information form this year. So health departments were asked to include the information in that form for all their staff working on their MCH projects. The other reminder is in 2024, making sure to copy your contract administrator on your GEARS fiscal reports, just so they have awareness that those are coming in every month. And then we also have our general MCH inbox, which I'm going to paste into the chat in light of my next update, which some of you have heard this from me and some of you have not. And that update is that I am actually departing from DHS on February 6th. So I'm kind of in the wind down period and working on transitions. So you will hear more from the DHS team. And I'm going to put our shared inbox in the chat just in case anything comes up and you're not sure who to go to. That can be a spot to reach out, and the MCH team will respond. I'm also happy to take any questions via chat or email. So I will put a couple links into the chat here shortly. I also want to make sure that I toss the ball over to Heidi. Heidi, did I miss any of the updates we had on the DHS end, or anything else you'd like to add?
I think you got them, Maggie. So, and then hopefully some of you got an email from me if I'm your contract administrator. So I will be working some in adolescent well-being. I'm not sure all the transition stuff yet. So, but I think Maggie had hit the highlights. So look forward to working with you all.
Heidi and Maggie, thank you so much for your updates. And if anyone has questions in particular for them, go ahead and communicate with them directly, I believe, into the chat. Otherwise, we can gather questions later on, or if anyone feels the need to unmute at this time and ask any questions, we can allow a little pause for that as well. Thanks, Maggie, for sharing that in the chat as well. All right, well, we will move on and provide you with a little introduction to UW-Madison's Division of Extension. Again, as I said earlier, we know that many of you heard some of this information at the beginning of the year last year, but we've had a lot of transition in our health departments, as well as new health departments adding to the MCH adolescent well-being objective. And so we wanted to give you, again, just a really high-level overview of who we are at UW-Madison Division of Extension, what we are committed to, what our presence looks like, and how we serve across the state of Wisconsin. So Extension has a commitment to serve all individuals possible, both through the work that we do and through the employment opportunities that we provide across the state. And so Extension's commitment is to, again, ensure that we reach all audiences possible, and that we make our employment available to all audiences possible. And so part of the way that we do that comes back to that demographic survey that we shared with you at the beginning. That helps us to identify, not just in this space, but in all of our programming spaces, the audiences that we are reaching. And so we, again, greatly value your taking the time to fill out that demographic survey and giving us that information to utilize for the work that we do. With that, Christina, if you want to jump to the Extension mission slide. There we go. Fantastic. Perfect. All right. So Extension's mission is really to embody the Wisconsin idea. And essentially what that means is we partner to develop and connect the research and educational resources and opportunities at UW-Madison with residents all across the state of Wisconsin. And we do that with a presence through our statewide network and our local ties. We have educators located in offices in 71 counties across the state and in 3 tribal nations. Christina, if you want to pop to the next slide, that would be great. Overall, our educators live in the communities that they work within, and they understand local needs and local issues. When we bring educators into our organization, we invite them to do something called a community needs assessment. So really seeking all input and information from across their community on the needs that are the greatest. And then as they do that needs assessment, we are able to work with them to define to further refine their work and their programmatic priorities so that they can meet all needs possible, utilizing the resources, again, that we have through our relationship and our presence at UW-Madison. And with that, I am going to hand it off to Debbie, who's going to talk a little bit more about how the MCH project fits within the behavioral health work that we're doing and where you can find more information about our MCH project and resources.
Great. Thanks, Danette. And I'm going to try screen sharing. So Christina, if I could have an opportunity to do that, I'm going to try to share this live. So hopefully this is going to work. Again, sometimes Zoom does not allow this, but we'll give it a try. So hopefully everyone is seeing kind of the front page of our behavioral health website. And if you go to that website, which we will put the link into the chat box, also after I've done showing, I will put that link in there so you have that exact link. For some of you who were involved last year, you'll remember this is the site to go. And then there is a tile where the Maternal and Child Health Title V Adolescent Wellbeing Technical Assistance is right here in the middle of the screen. And so if you click on that, and I'm hoping that it is going with me, Danette, I'm going to look at you to see if now everyone is seen. All right, awesome. So again, this is the technical assistance page. And so again, you can see here, there are the recordings for the learning community calls, and some of our calls disappeared. We're trying to figure out where they went from last year. But if you are interested in going back, if you're new to the project and want to go back and listen to any of these, they are there from last year and will be hopefully soon the others put up. There are some links and resources in there, and we're continually adding links to that, links and resources. And then there's information about the youth wellness team. And then also how to contact us at the bottom. Again, that is our email address that you can send any of your questions to for the team to reach back out to you. But one of the things that I wanted to share, and again, for those of you who were involved last year, you're familiar, there is a map that we have created that has all of the counties that are involved in this particular grant project. So we have updated that for the 2024 information. And again, this map, you can see the counties that are involved, also the tribal nations that are involved, and then local health departments that are involved. The other part that this grant will do, and I'm just going to click on Manitowoc County, I'm just going to pick that out, which we're going to hear a little bit later from Manitowoc County. You will see when you click on Manitowoc County, you will see what extension presence is in that county related to adolescent well-being. So again, you will see in most cases food-wise, you will see health and well-being educator if they have a health and well-being educator. There may also be, I'm going to go to Portage County. Let me go there real quick. You may also see a community youth development program educator. You may also see a human development and relationships educator. Those are the individuals within extension that are most directly related to this work. And so we wanted you to be able to know what is the local extension presence that you can reach out to for assistance or resources. So again, interactive tool. We'll try to continue to keep this updated so that if there's new extension educators being added, we will be adding those links here as well. So I'm going to turn it back over to Danette.
Great. Thanks so much, Debbie. I want to pause for just a second and see if anyone has any questions up to this point. We did have a question in the chat, and I'll just share that out with everyone. They were asking if slides would be shared. We will send a follow-up email with all links and resources, and we can certainly send a PDF of the slides as well, if that will be helpful for everyone in that follow-up email, just so in case everyone's wondering. Of course, there'll be lots of things coming into the chat throughout the time today. We'll make sure that all of those resources, again, are sent in a follow-up email. I know sometimes it can be distracting to feel like you have to copy and paste every link from the chat and get those opened in another browser. So if that helps you be able to be a little more present and focused with us today, we'll take care of all of that for you later on. All right. So with that, again, feel free to put your questions or comments in the chat. We're happy to field those as they come in. We wanted to spend a little bit of time sharing with you what we have envisioned for the scope of work for the upcoming year. So Christina, if you want to go ahead and screen shares. Yep, there we go. Fantastic. Starting on slide 12, you can see the priorities or the objectives that we have identified for this year. So the first two essentially look the same in terms of the language around what we're hoping to accomplish as a part of our technical assistance with all of you. We'll talk in just a moment about the details within each of those objectives. The third objective is a new objective that we added on this year as a result of many of the conversations, learning community calls, office hours, as well as some one-on-one technical assistance. We really started to notice a theme of some concern over burnout and some decreasing compassion resilience amongst local and tribal health department staff. And so with that, we added a third objective to our efforts to support all of you around reducing burnout and building compassion resiliency amongst local and tribal health department staff. We know, as well as you all do, right, that in order to do the work that you do and build well-being among adolescents, we need to make sure that we are also taking care of ourselves. And we felt it would really be remiss to provide a bunch of tools and resources to you if we didn't also help you address your own well-being and the well-being of your staff. So you will see that incorporated throughout the opportunities that we provide as a part of our technical assistance over the course of this year. So under objective 1, again, a few things have changed that in terms of how we will carry out this objective this year. We'll continue to work on building relationships between local and tribal health departments and our local extension educators, as well as statewide resources. We're still committed to maintaining that collection of web-based resources to support evidence-based, equity-centered strategies for adolescent well-being. We will continue to offer quarterly mental health first aid, youth mental health first aid trainings, and we'll be sharing dates for those out with you in our follow-up email as well. This year, we've added QPR training, so that question, persuade, refer trainings. Last year, as a part of our scope of work and the objectives, we worked on building capacity around extension educators that are trained to facilitate those programs. So now this year, we'll deliver on that capacity that was built by offering those virtual opportunities out to local and tribal health departments. We'll continue to distribute a monthly newsletter. There'll be an opportunity for you every month to highlight something that you are doing in your local or tribal health departments that would be really valuable for your colleagues around the state to hear about. So we'd really like to just emphasize again, we had this ask all last year, and we'd like to continue the ask of sharing with us the highlights and the things that you are doing that can be beneficial and inspirational to colleagues around the state. So please share that information with us so that we can highlight and feature your work with your colleagues around the state. We'll have 4 total learning community calls. We'll share the dates of all of those learning community calls a little bit later on today. And we'll continue to offer our monthly office hour sessions. Topics for those, both the calls and the office hour sessions, we are leaving open to your feedback and your input. So as we have some ideas for things that we would like to structure those calls around, but we also want to be very responsive to the feedback and the themes that we're hearing from all of you over the course of the year too. So please, again, take the time to complete our evaluations and our surveys. And we'll have a poll today within this call to help us sort of prioritize our focus and our efforts. But again, we want to be responsive to your needs and not just the needs that we see or we think are important on our end. Under objective 2, we have a few additional pieces or things that are going to look different as we address objective 2 this year. We have committed to creating a toolkit of evidence-based strategies around youth development and youth engagement. And Jen Braun, our prevention special, or our specialist, will be leading, our health equity specialist will be leading the charge on that. She will also be working with Taylor and the youth wellness team as they complete the youth advocates for community health process. That youth wellness team will be sharing their efforts. They'll be sharing what they've learned as well as their results with us over the course of this year. We'll also be providing technical assistance around completion, action planning, and reporting with the youth engagement assessment tool that you all are required to complete. We'll also provide technical assistance around youth engagement in coalition efforts. And then finally, we've also committed to creating a toolkit of evidence-based youth AODA prevention and response strategies. And Debbie Moellendorf will be leading and supporting a team of educators around building that toolkit out for you. So we are really excited to take all that we've learned about the needs that you all have and sort of the gaps in resources and really applying that to this objective and providing you with those tools and updates as the year goes along. And then in response, in that third objective, we have made a commitment to engage with all of your departments around compassion resilience opportunities and to provide you opportunities to participate in our We Cope, which stands for Connecting with Our Positive Emotions courses, virtually over the course of the year. So we've committed to providing at least 2 of those opportunities for your staff to participate in to support their well-being over the course of the year. So again, more to come on all of these scope of work efforts, but opportunities for us to, again, expand on what we learned in year 1 and really apply it, hopefully with some things that are going to be really valuable for you moving forward into the year. And again, we'll look forward to opportunities to hear from you what is going to be the most valuable at this time as you move through your work and your efforts in the upcoming year. All right, we have a slight adjustment in our agenda because that's just the way these kinds of meetings go. Sometimes we get ahead, sometimes we get a little behind. We're ahead on our timing of our agenda. So we're going to jump to Jen, and she is going to give us an update on the youth wellness team and share some feedback as we wait for our youth, our Raise Your Voice youth to be ready to go.
All right, Christina, could you skip to slide 28, please?
Yes, so I have to unshare and reshare, so hang with me, everybody.
No problem.
Jen, I'm so sorry. What was the slide number you said again?
28.
Okay, that's what I thought. Okay.
Thanks, Christina. So as Danette had been talking about, we have our youth wellness team as part of our project this year. They formed in July of 2020 in partnership with Patch. Patch advocates are serving as consultants for our extensions MCH work. So we have young people from across the state that have signed up to really help make a difference in the health of our state. You can see from the map on here some of the locations where we have young people from Marathon County, La Crosse County, a couple of students from Dane County, Racine County, Winnebago County, as well as Brown County. On the next slide, you'll see we did a little bit of surveying and really talking with the young people about why are you interested in health? The word cloud here that's on the left really shows the many different topics that the young people had mentioned, like these are what they're interested in, some of the things that they'd like to learn more about. And then you'll see on the right, when asked, why are you interested in health? There are a few quotes. They really demonstrate how in tune these students are to health and their desire to really improve their environments and communities. They had things to say like, I want to make a tangible difference. I want to serve my community. I would love to engage in some research. I want to prompt positive change or spread awareness at a statewide level. I want to make a difference, and I want to help the state of Wisconsin better provide health care. Next, we have our project timeline. So we started, like I had stated, in July of 2023, going over some program expectations, some group agreements, some ground rules. In August, the youth wellness team have been serving as consultants on some online modules that were created around health equity, social determinants of health, and policy systems and environmental change. In September, October, November, December, we worked on really identifying some issues and looked at some youth behavioral health and youth well-being issues. And we have been doing some research using the CHIP-CHA, YRBS, identifying what are the needs within the state and counties. So looking to the future, we're looking to identify some of the vision projects and get our SMARTY goals in line, identifying some partners throughout the state and gathering some support from those partners. We intend that March to May is going to be implementing the plan and then doing some evaluation, and we'll be giving y'all an update in June with a final presentation on what that work looked like for the young people throughout the year of their project. On the next slide, you'll see that I'll just let you know it's been a little challenging narrowing down what health equity issue the young people want to focus on. The group is really diverse, and the differences in what they're seeing in their community. We have very rural communities, we have urban communities. So in January, our team members looked at the CHIP-CHA and the YRBS reports from their own counties. And then next, we plan on doing a deep dive into their county-specific CHIP-CHAs and YRBS to really find those commonalities and hopefully soon identify an issue that the young people can all rally behind. So now on every learning community call, we hope to share with you a brief video so that you can also get to know the wonderful young people that we have on the team. Today, you're going to get to meet Allie, and apologies in advance for the poor video quality. Sometimes the Zoom calls and technology issues are really just a part of trying to bring this group of young people through that are in very different parts of the state together in a fully virtual environment. So Christine, if you could play the video, you all can meet Allie.
Hi, my name is Allie Wifley. My pronouns are she, hers. I am a junior at Denmark High School, and health to me means that people's needs of any sorts are being met that has to do with their mental or physical well-being. I'm a huge list person. It helps me stay organized. I also love helping people. I have loved helping people since I was very, very young. Having a brother with special needs, I've been in and out of hospitals my whole life. So just being around that environment, I have learned to love helping people and just being a person that someone can rely on and can make them smile in times of need. And another thing about me is I am currently a sterile processing technician in a hospital. So I clean the tools and put together the packs that they use for surgery. I am interested in studying nursing. I want to be a nurse one day. I would love to specialize in pediatrics. I am a huge kids person. I have 2 little brothers, and I love kids, and it would be even better if I could get into some kind of oncology department, because I've seen sick kids and I love being able to be that person that can put a smile on someone's face. So even 5 minutes of my time to make a sick kid smile would just make me so happy. And knowing that I could be a light during their day is just something that brings me joy. So nursing, oncology, and peds are my 3 big things. We've been taking things that we're passionate about, things that we see could be better or could be changed within healthcare or getting healthcare or providing healthcare. And we've been working on figuring out ways to better it or change it. First of all, everything that I've learned so much just about Wisconsin healthcare as a whole. And also the people that I've met and have been able to get close to along the way have been super, super nice. And I'm just loving being a part of this team and feeling like I have a voice and like that ability to help people. I would like them to know that we are humans as youth. We have thoughts and we have opinions, and we'd like for local and tribal health departments to know that sometimes like we aren't taken seriously, and we would really like to be, because we might be treated like we don't know things, but we do. And even if we don't know a lot, we still know enough. And if we don't know, then we'd like to be taught, because we'd like to participate in our healthcare and we'd like to be able to be advocates for ourselves.
All right, Christina, thank you for sharing the video. So Allie is just one of our 7 team members. We hope every learning community call that we'll be able to share a new video, and you can look in our newsletters. We're going to have a little brief blurb about each of the young people, as well as a link to a video and a picture of them. So they're excited to meet y'all, but as you know, this is not a great time for young people to be on and join us. So I'm going to pass it over to Debbie Moellendorf to talk a little bit about Raise Your Voice.
Thanks, Jen. And I am very happy to share that Reggie, who is a senior at Merrill High School and the current president of the Merrill Raise Your Voice Club, has been able to join us today. She's working between her classes to be able to be on. So I'm excited to that she was able to make that work. So today, Reggie and I would like to share with you some information about a way that you might potentially be able to partner with schools or other youth organizations to really engage young people through supporting the creation of a Raise Your Voice Club in your area. I've had the pleasure of helping to start the Raise Your Voice Club at the Merrill High School about 4 years ago. Right before the pandemic, we were about to kick off the club, and we ended up having to kind of wait a little bit, but we did get the club started in the school year following. And so it's been really exciting to work with that club. And then over the past year, I've had the opportunity to work with 6 additional schools to get clubs started in the NAMI Northwoods area of Langley, Lincoln, and Marathon counties. And so Reggie and I are excited to be here today and to share with you a little bit about what Raise Your Voice is. And then you'll have a chance to hear from a couple of other counties about how they are helping to support Raise Your Voice. So if you want to go to slide 17, and then Reggie, I'm going to turn it over to you for a couple slides here.
All right, I hope this volume works. This is on the school Chromebook. Is it good? All right.
Yep, you are great.
Okay, I'm Reggie. I am a senior at Merrill High School. I'm the president of the Merrill Raise Your Voice Club. I've been an officer of the club for 2 years now. So Raise Your Voice is a NAMI program, and it's kind of centered around a very broad mission statement that says we are going to empower students and promote mental health resources, develop advocates and leaders, and create an overall greater dialogue for mental health and wellness. This mission statement, then, if you look at slide 18, kind of converts into goals and objectives. It's basically the same thing, just restated and categorized. But the general principle of the club is to just get youth more involved and more comfortable with mental health.
So a little bit about the history. Raise Your Voice really started in 2016 as a huge gap of mental health support was recognized across school systems all over Wisconsin. And after a local family lost their child to depression, they decided to give a very generous donation to NAMI in Wisconsin. And through that donation, Raise Your Voice took off and has become a vibrant, growing club, and is across the state in many schools. There are some youth organizations such as Boys and Girls Clubs, YMCAs that also have Raise Your Voice clubs. But again, through that very unfortunate event, I think a very positive action has happened in the development of these clubs. Some people here might be really familiar with NAMI and the structure of NAMI. And so NAMI really stands for the National Alliance on Mental Illness, and it's divided into 3 entities. There's a national, state, and local level. The goal of NAMI as a whole is to improve the quality of life for people who are affected by mental illness and to promote recovery. In addition to support through NAMI Wisconsin, there are also 26 affiliates across the state. So you can see on this slide the map of the affiliates that are located across the state. So for example, NAMI Northwoods, which I talked about earlier, the Lincoln, Langlade, and Marathon County area, has really identified the creation and support for Raise Your Voice clubs as a goal that they have as an affiliate. And so they are providing additional support of personnel and other resources to support that expansion of Raise Your Voice. And they're doing that through a partnership with Aspirus Health, which is our local health hospital network. And so that hospital network has been giving donations to NAMI Northwoods, and then NAMI Northwoods is using that to support that personnel and those additional resources. And Reggie's going to talk a little bit about one of those resources as I turn it back over to her.
All right, I'm so excited to present on this. I haven't gotten to present this yet, but so the best thing that has happened to me in the time I've been in high school, on December 18th, the Merrill Raise Your Voice Club, along with 6 other clubs in our NAMI Northwoods area, got to present and speak with Governor Evers regarding youth mental health. So during the day, we presented to him to begin with, and then we actually got to sit down in a room in a circle with just the leaders, like kids, and him, and it was such a cool experience. But this occurred as a result of a presentation that the Merrill Raise Your Voice club officers had done last spring in a state webinar hosted by the Office of Children's Mental Health. We got to share this with, like I said, with 6 other clubs in the area, and we opened it up to officers. So each club brought 2 officers. These were from Wausau East, Wausau West, DC Everest Junior and Senior High Schools, and then Marathon and Anago, as well as Merrill. And we just got to share what we've been doing and why mental health is important to us, why we think that it's something that needs to be taken care of and needs opinions on it and regulations. And he was very receptive to everything we said. So it was really cool. And then on the next slide is just, we asked each club to bring 2 things that they do as a club that's unique to them. Cause like there's overlap between the clubs because Merrill High School started up Raise Your Voice, but then like East was next, East and West, and they do stuff that we do. So everybody was supposed to do something unique. So the things that we had shared were our Mental Health Mondays that we do at Merrill High School, which is the first Monday of every month. All of the officers, and it ends up being like 24 people total, travel to every like school that isn't the high school. So all the parochial schools, elementary schools, and the middle school. And we'll just share, like this last month, we gave them stickers and we just say, have a great day. And they're always just so excited to see us. And it's so, so fun to go and see them. And it's actually, my favorite thing that's come out of that is they told us at one of the elementary schools last time I was there that one of the kids came up to one of the teachers and was like, what's mental health? And these are like 2nd graders. And they're doing a lesson for these like 2nd and 3rd and 1st graders on what is mental health. It's just so cool. And the other thing we do as Merrill High School is we do the summits, which, like I said, NAMI Northwoods area, we were the first people to start. So we basically coach other Raise Your Voice clubs into how to be a club. So it's things like, how many officers should you have? Like, what's reasonable? How do you guys function and define responsibilities between each other? And then how do you run a meeting with your large groups? And it's actually been really nice now that other clubs are started up. We get to basically just come together every now and then and collaborate about what's everybody doing. So it's almost like Raise Your Voice is just so many programs, and we're all very similar but very different. And there's different levels in each school, and it's been so cool to see that spread in the time that I've been in the Merrill Raise Your Voice Club.
And Reggie, you have an event tomorrow, right? If I'm remembering correctly?
Yes,
or
I
Wednesday?
have Thursday.
Okay.
Thursday we have in Weston with all the other Raise Your Voice clubs, and we're bringing all of our officers and 6 club members. as developing officers. And we have an art mural we're working on and collaboration, like bonding games. It's going to be fun.
Thanks, Reggie. I just happened to remember that that was coming up. All right, so again, as Reggie talked about, there's kind of the basis of the club is the same, but the idea is that Raise Your Voice really needs to fit the school or the youth organization and that environment in which that club is offering. So there are some requirements of Raise Your Voice clubs, and again, you're seeing these on the screen here. But again, they try to keep them to a minimum. So again, the club has to be hosted in partnership with a school or community youth organization. You need to hold a general member meeting at least monthly. Primarily, the club has to be youth-led. That is a very important part of this club. It is driven by the young people. They are the leaders. They are the ones deciding what activities, what goals they want to work on. Because again, they know what's going to fit and what the needs are in their school or their youth serving organization. The club has youth leadership positions, and the club hosts at least 2 projects or special events for school. And again, some of the clubs that are just getting started this year, like Anti-Go or Marathon, may only do 1 or 2 events this year, and that's okay because part of it is also helping to develop that club. Again, the Merrill Club's been in existence. This is the 4th year. So the club is pretty well established and has about 100 club members in the club. So again, what they're able to do may look very different from what a club that is just getting started. So I think that's an important thing to remember. And we remind clubs of that all the time. Like, don't base it on what you're seeing from other clubs. Make it be what works for you. There also are requirements of the advisors for the club. So at least one of they recommend at least one advisor. Recommend that you have to have. That you have to have one advisor, but they recommend 2. And at least one of those advisors has to work with the school or youth organization. So again, it's really important that there's someone with that organization that is hosting, or that school that is hosting the club, that makes a commitment to be an advisor. Advisors have to have some educational background in mental health. Again, the advisors in the Merrill Club, we have had a school counselor who obviously has a background in that area, but we've also had teachers be a part of it who are just passionate about this area and want to support and help students. And so again, doesn't necessarily have to be someone who has a degree in the mental health background. But if you do not have that degree, then there's some additional training that advisors are asked to do. There's communication with NAMI Wisconsin that's expected. Again, this is a program of NAMI Wisconsin. They are helping to support it as well as our local affiliate. And so we want to be communicating what the club is doing and sharing the story and the impact. So again, as I talked about earlier, the resources are coming through the NAMI Wisconsin website. And so again, in order to gain access to this website, you do need to reach out. And the email address is on here, programs@namiwisconsin.org. It is password protected, so you would need to get that password to get onto their portal to access those resources. But that's the idea of all of those resources being available to clubs. So I indicated that we have a couple of counties that are going to share a little bit about how they're working with Raise Your Voice. You've heard about my story and how I've been working with Reggie and others at Merrill, but wanted to give a couple of other counties a chance to share. So I'm going to ask Kat in Manitowoc to share a little bit about what she's doing to help build and support Raise Your Voice clubs in Manitowoc County.
Hello, everybody. So I work with Jenny Gleichner, who's actually on the call. Was over a year ago when we initially got the email saying to reach out to our local public health. They received this grant, the Title V grant, and I remember doing that. I'd known Jenny for quite some time, and so I thought I would just sort of share what we're doing because we don't have a club up and running yet. we have high hopes that one will happen. But just to give you sort of a sense of, Debbie said, just talk about how the seeds you've planted. So I took a little time to kind of think back to what initially happened. And initially, Jenny and I sat down and we just started brainstorming about what did we know about our community and who are the movers and shakers, what kind of youth programs or groups were going on in our community. And we identified something called Kids at Hope, which is our human services philosophy of all children are capable of success, no exceptions. And so we started thinking about who are the people that might be able to help us connect with youth, and are there any youth groups currently operating. We knew that in Manitowoc County, we had Healthiest Manitowoc County Coalition, and they had a substance use and mental health group. So we also set up time to talk with that group and learn a little bit more about, or because both of us participated in some of those settings, just to share a little bit more about what Raise Your Voice is. Our school district in Manitowoc County has been challenged by leadership, and we have had very little support. Though the educators see the need, the leadership, there was some challenges. So really right now within the school district, we did identify a group called Ally, and that is consisted of parents and educators who really believe in mental health, youth mental health, and we've stayed connected with that group. We knew that there was a runaway and homeless youth program in our community, and also had youth that maybe fell through the cracks that might be interested in an opportunity to build a club that might be from more than one school. We did end up finding at our Lincoln High School in Manitowoc that there was a club of students meeting without real direction, but they did have an interest in and lived experience with mental health. So Jenny and I presented to that group last May and talked about what Raise Your Voice might look like. And that group at the time felt like it was a good fit, but the timing of first meeting and getting in front of them in May didn't really, there was a chunk of time then that they weren't meeting. In fall, we did meet again with potential. There were 2 advisors that had interest at that time that were already providing support to the group that wasn't really named but was meeting. One of those, there was a lot of changes in our school district with staffing, and one of our potential advisors changed roles. The other one was off site, not at the school that was looking at Raise Your Voice. We had support from the principal, still do, and we had a young person step up to and was really excited about Raise Your Voice. And then in, I think it was October, after several meetings, we got a follow-up that they were hitting the pause button right now, and that they would connect with us when the school and the students were ready. So that kind of, there felt like there was momentum, and now we're sort of at a plateau. But in the interim, there is a parochial school that has interest. And so we're in the initial phases of what might that look like. But also because of the work that we've done with these other groups that I mentioned, a youth council is being developed, a county-wide youth council. So I think about youth advocates for community health, think about this potential Healthiest Manitowoc County Youth Council, our runaway program that has young people who are disengaged in schools, but maybe are and want to participate in something. So even though the Raise Your Voice group hasn't yet manifested, some pretty neat conversations are happening among youth serving agencies, coalitions. Our NAMI, we do have a local NAMI, and they're very supportive. They supported us going to the summit this last August. They paid for our mileage, said they would pay for our meals if we needed it. So I think while we don't have really a success in that we have a group shaped, we are still moving forward. And I did let Jenny know that if I missed something that you wanted to highlight, I would give you an opportunity to do that.
I think you covered everything really well. It's just been a challenge to find an organized group of youth to help us move forward, because we want this to be youth driven, because it's their club.
So thanks for giving us a little bit of time, Debbie.
Thank you very much, Kath and Jennifer, for sharing. Again, I think it's really important to share that perspective of the relationship building and building the support and the foundation. This stuff doesn't just happen overnight. There has to be that relationship building and building that foundation for the club to be able to be formed. And again, sometimes the timing just isn't right, but other really positive things can come as a result of those conversations. So thanks again for sharing that. So I'm going to ask, Portage County has also had some experience, and I see that both Lynn and Leah are on from Portage County. So I'm going to ask if you can just share your experience of what's happening in Portage County around this area.
Yeah, so I'd be happy to do so. So a little bit of historical background of kind of how we got started with the Raise Your Voice is we have a subgroup with like a youth focus through our mental health coalition, our Prevent Suicide Portage County Coalition. And so we've been meeting about 2 years now. I kind of facilitate that team. And so we have individuals or representatives of our community schools, and both public and private. And we also have a organization through CAP Services, or a program called Mental Health Navigation. And so they have youth kind of advocates based in some of the schools, or they collaborate or work within the schools. In our Stevens Point area public school, or SPASH, has the largest, or that they're primarily located in SPASH. And so the advocate there was really passionate when they heard about NAMI Raise Your Voice, and kind of started the balls rolling with just kind of doing some presentations to our youth subgroup participants, and as well as engaging with the school about starting this club up. And I think it was kind of slow going, but we've gained a lot of momentum as far as this year. They're kind of rolling it out in phases. Additionally, last spring, we had kind of a youth panel that present to our coalition about just talking about mental health and concerns. And I think it was really through that panel discussion, it was and as the adults or the coalition, we were pretty amazed at, kind of maybe the need that's there. And so that we felt that this was a really great opportunity as well. So so they started gathering officers and kind of rolling out the initial phase the first semester of this year. And so they have a great group of individuals who are kind of in the leadership for the club. And then kind of moving forward into this month, in the second semester, they'll be building on gaining other additional members. So they've just kind of been growing and supporting their leadership, the first kind of phase, and getting that rolled out. And now they're going to be recruiting members and kind of working on those next steps. But as public health, kind of how we've facilitated or supported this is just, we attended the summit. Leah attended the summit this last, I think August was when it was. And we'd like to expand this out to other schools. And so kind of with our, the block grant, we'd like to help, because there's capacity at any organization. So we want to help expand this out to the rural areas especially, and also tap into the resources probably with there's established clubs to kind of get that youth voice and kind of maybe build a council or something similar in our own area. I don't know, Leah, is there anything you wanted to add?
I think you covered everything. Just hoping that SPASH can kind of be our Merrill school and be the step we can kind of spread everything. And we're just excited to see what they're able to do. And I enjoyed hearing everything from the Merrill group over at the summit. It was very motivating and just so special to hear everything. So we're hopeful to bring that here to Portage County.
Thank you both for sharing, and it's wonderful to hear how Raise Your Voice continues to grow and expand. And again, I think going back to what you were sharing, Lynn, it's about creating that strong foundation and spending the time creating that foundation that is going to sustain the club. Again, when we started the club in Merrill, we spent the first 6 months of just working with our leadership officer team to create that foundation before we were ready to just launch recruiting club members in March of 2020. And we all know what happened in March of 2020. Schools went to virtual. But again, we heard very loud and clear from that team of officers when they came back to school in the fall of 2020, we need to get this club going. And so that's where we really kind of launched it. But again, it's really important to spend that foundational time there. So I'm going to ask, and I believe Reggie is still on. Want to give an opportunity if anyone has any questions that they would like to ask of Reggie or myself or any of the folks who have shared about their story before we move on to our closing. I haven't been monitoring the chat, so I'm not sure if there are any questions in the chat.
I haven't seen any questions come in, but hopefully you've had a chance, Reggie, for sure, to see the excitement that people have had over your presentation. So, but certainly, if others have questions, let's open the floor. We can all learn when others ask. Debbie, I don't know if you see. I was just going to say, I'm going to let you answer that question.
And I'm actually going to let Reggie answer that question to see, because it is a question of you, Reggie. Would you be willing to provide your presentation and success story to other schools throughout Wisconsin? And again, you don't have to answer that if you're not comfortable.
I'm a little confused by what it's asking me. I'm not going to lie. Like how I got into Raise Your Voice, or I'm confused.
Okay. So I think what you're asking, Reggie, is it more about, are they interested in you sharing your personal story about why and how you've been involved, or about the club at Merrill? Is that kind of what you're trying to ask?
Yeah. Okay.
Yeah.
So I've been in the Raise Your Voice Merrill Club I joined halfway through my freshman year, which was 2020. So I was a little late into it. But so then I just kind of sat there my freshman year. I was a very nervous child, did not participate. But then my sophomore year, I was like, kind of got into it more. So then from there, I was actually involved in the club. I helped with activities, and I got to know like the officers then. So then I applied to be an officer at the end of my sophomore year for my junior year. So I was the vice president of the club my junior year. And the coolest thing I did that year is between two things, and that's I did a segment on PBS Wisconsin for Raise Your Voice. And that was super cool, especially actually seeing that get released, and it's like under the whole, like that was cool. And then we went to Madison for Raise Your Voice, and then we talked to legislators and their assistants at the Capitol about advocating for mental health, and that was really, really cool. And then this year, president of the Raise Your Voice Club, so I kind of just into it. I think we've been way more active this year than we were last year, which is kind of cool. But it's been fun so far. We've done some cool things. Did a summit in, I believe, October, and that was big. There was a lot of people at that. I'm doing another thing in Thursday and another thing in like April. So I got all the things. But Raise Your Voice has been so fun to be a part of. And yeah.
Keeps you very busy, I know. So I think if people are interested in having more information about Raise Your Voice or having a presentation about Raise Your Voice, you can certainly reach out to me, and I can help to facilitate that connection. And I know Reggie for sure is always interested in sharing the story about Raise Your Voice and the success and what's been happening in Merrill, as well as the other schools that they are also helping to support through the summits. But again, just reach out to me if you're interested in that, and we can make that happen.
Debbie or Reggie, do you know, are there dates or is there another summit scheduled? It sounds like the last one took place in October-ish. Do you know if there is a summit in the works for this year?
I would anticipate that NAMI Northwoods will probably do another summit next fall. Sometimes they do one over the summer as well. So again, I'm not sure, not part of that planning team anymore, so I don't know for sure, but that has been kind of the pattern of a fall summit. And then I know NAMI Wisconsin is also hosting various summits, and I believe there's that event in April, Reggie, that you're talking about that's coming up. I don't know if that may be being hosted by the Office of Children's Mental Health, if I'm remembering correctly, and Raise Your Voice is one of the groups that's been invited. So again, they are hosting youth from a variety of groups affiliated and working on mental health. Raise Your Voice is one of them. Sources of Strength. There's a group in Madison, and Reggie, I'm looking at you. I'm not sure if you could help me remember. And the Hope Squad, I think, is part of that. But there's like 5 different youth organizations that are being invited to be part of that.
Thanks, Christina, for putting that in the chat. Great.
Well, before Reggie has to go, I know she needs to probably get back to class, but I do want to thank her for, she's shaking her head no. I do want to thank her for being a part of taking time to be on this call to share with the group the story of Raise Your Voice and her involvement in Raise Your Voice. It has been my true pleasure to get to know Reggie and work with Reggie over the years that I've gotten to know her. So I very much appreciate it, Reggie, and I hope you have a great rest of your day.
Thank you so much for having me. I'm going to go to Spanish now. Bye, everybody.
Thank you, Reggie. All right. Any questions for Kath or Jennifer, Leah, or Lynn and their health department perspectives or extension role? They could certainly field questions in that space as well before we move on. All right. Well, don't hesitate to share with us in your evaluation for today if there's anything in particular that you'd like to learn more about when we get to that space. We wanted to share with you the learning community call dates for 2024. We have April 22nd, June 24th, and September 23rd slated to round out our year. We look forward to planning and preparing those calls, and also, again, being responsive to the needs that you identify for us. So again, don't don't be shy in sharing your thoughts and ideas on how we can best support you as your technical assistance team for your work. Next, we wanted to share with you a few resources and also give you an opportunity to, we'll open the mic up and give you an opportunity to do some resource sharing amongst your colleagues and on how you are addressing adolescent well-being and resources that your colleagues might find valuable. We wanted to let you know that the 2023 YRBS reports have been released to local school districts. So there isn't a statewide report that has been made available at this time, but local school districts have been provided with their reports. And if you are, we certainly encourage relationship building amongst health departments and schools and collaborating on those community needs assessments, both and action planning at the school level and at the county level. And so you can certainly reach out to your local school districts and collaborate around that. When the statewide report is released, you can rest assured that we will share some of that information with all of you as well as a part of a learning community call or an office hour session and look at changes and trends that we're noticing in that work. We also wanted to let you know that there are some injury prevention funding opportunities through DHS, and we will be sharing some links with you again in the follow-up related to those funding opportunities. So we wanted to make sure that you are aware of those and on the lookout for that. Also, to raise awareness around the Resilient Wisconsin newsletter. So this is a newsletter resource that is available and, oh, great. Awesome. Look at that. Christina's popping things into the chat as we speak, and we'll also share them in our follow-up email as well. So Resilient Wisconsin newsletter has some valuable resources that can support you as you work to address adolescent well-being. As we review those resources, we'll try to pull them out and highlight them in our newsletter out to you. But again, wanted to make sure that you had access to that and were able to subscribe if you were interested. We also wanted to let you know that the Office of Children's Mental Health had released their annual report and also a recorded briefing on that annual report. Christina has also put that in the chat as well, and we'll make sure to share that out. But if you haven't had a chance to review that, it is a great resource to really take a look at. We highly recommend it. Looking at that report is really valuable to us and our extension team across the state as well. With that, we wanted to open the mic up for any resource sharing, again, from health departments. If there is anything that you have found valuable in the recent months as you strive to address adolescent well-being and you'd like to share it out with your colleagues here, now is an opportunity to do that. You can certainly put it in the chat. You can also come off mute and share those resources with each other as well. Right. If anyone thinks of resources, again, that would be valuable and you would like us to highlight in our newsletter, please go ahead and send those resources to us. We would love to feature the things that you are finding beneficial and supportive in the work that you are doing as you address adolescent well-being across the state. Next, you're going to see Christina pop into the chat a link to our feedback and evaluation survey for today. We are not quite done yet, but we also know that as we get close to those closing slides, people tend to hop off the call. So Christina's going to put our evaluation into the chat. If you go ahead and open that up, and before you leave the call today, please take just a few moments. There are just a few questions on there that gives us an opportunity to understand how well we served you today, as well as an opportunity for you to let us know what you'd like to hear more about. And you can share resources through that survey as well. Next, we want to make sure that you are receiving our monthly newsletter. So if you have not been receiving our monthly newsletter, it does come out typically on the very last day of the month or the last kind of business day of the month. And that should be coming into your email inbox. If you have not been receiving the newsletter, please let us know. We want to make sure that we get you added to that email list and get that information. In that newsletter, we provide a variety of resources and updates. We are going to feature our youth wellness team as a part of the newsletter in 2024, some progress on the work that they're accomplishing. And we also have a self-care corner in there. So included with our efforts to support local and tribal health department staff well-being, we're including a self-care corner in every newsletter as well. So just an opportunity for you to take some time to take care of yourself and be reminded of skills and strategies that can be beneficial to you as well. Great. Thanks, Christina, for putting that in there. If you have any questions, if you have any needs, any way that we can support you, if you're not getting access to the newsletter, please feel free to email us. Our youthhealth@extension.wisc.edu is the best email address. All members of our team have access to that email, so we are able to kind of route that and make sure that the right individual is able to answer your question and provide you the feedback or the necessary information that you need. My work phone number is also listed on there. You're welcome to give me a call. I have been doing an awful lot of old-fashioned phone calls these days, and I really enjoy the break from looking at my screen and Zooming with people. So if you reach out with a question or request, I might just request a phone call. So, and we can also schedule Zooms as well, but we're happy to support you and take your suggestions and even sometimes just some thought partnership. We took a few phone calls last year as a part of our technical assistance to just really think through support and again, ways that that health departments can make connections, build opportunities for youth engagement and youth voice, and also partnerships across the county as well. So sometimes just some really nice thought partnership around the work is really helpful. With that, our next slide is just going to remind you of our upcoming Learning Community Call in April, as well as our next 2 office hour sessions in February and March. And now is another opportunity for you to offer up any questions that you might have. You can put them in the chat. You can also come off mute if you would like. Please take a moment and complete our feedback, evaluation, and survey so that we can get your input on this call today as well before you sign off. Otherwise, if you don't have any questions and you've taken time to complete that, we have reached the end of our call today. Oh goodness, Jen, thank you for reminding me. I skipped right over the poll. That was back a couple of slides. Christina, can you put our evaluation or our prioritization poll up? Gosh, thank you so much.
Absolutely. Okay, the poll is launched.
There we go. If you would take just a minutes for those of you that are still on and share with us your priorities for MCH for 2024, that would be fantastic. Again, we'll use this information to help us prioritize the content of all of our calls and office hour sessions as well. All right. Thank you so much for joining us today. Please don't hesitate to reach out and ask questions, connect with us. We look forward to the next opportunity to support you.